Hello and welcome to the HacettepePathology.com Case of the Month series. Today I'm going to share you a case with very interesting association between two soft tissue tumor, and this is from as you see, this is a cartilaginous tumor and the biopsy is taken from the hand, and the diagnosis is consisted with enchondroma, and the important thing to note in the fingers, the cellularity does not mean something like malignant in the small bones of hands and feet, and enchondromatosis should be considered in the cases of enchondromas of hands and feet, and the radiological correlation should be done as usual in all bone tumors. I'm going to focus in high power, and as you see, these are reactive looking chondrocytes, and it's quite cellularity, but as I told you, the cellularity in the hands and feet, in the small bones and hands and feet, it doesn't mean malignancy. But in this case, we had a second tumor after a while, which is quite the same with in terms of cellularity, but we have this bone surrounded by the cartilage tumor, and here in this bony trabecular, this is host bone here, you have this infiltration of this cartilage neoplasm within the host bone. So again, in the hands and feet, you should be still careful and not to call chondrosarcoma just with this criterion, and please, so this area, for example, here is normal in enchondroma. You see the bone is lining and bordering the tumor, but here this is not expected in an enchondroma. But again, you should correlate with the radiology, and in this radiological correlation, we found a very large tumor destroying the finger. So we call this tumor as grade 1 chondrosarcoma, and but I'm not going. The purpose of this video is not the infiltration of the host bone is nicely presented, but I'm going to show you another lesion seen in this patient with enchondromatosis, and this is a vascular tumor is composed of these cavernous areas, and here again we have these philobolites here and large spaces with the cavernous cavern formation, and here we have this somewhat spindled areas resembling Kaposi sarcoma, but in this case you're going to have this vacuolization of the cells here. As you see here, you have this lipoblast-like vacuolization of the spindle and endothelial cells, which is characteristic for spindle cell hemangioma, and the co-occurrence of spindle cell hemangioma with enchondromatosis is called Maffucci syndrome, and there are two syndromes of enchondromatosis. One is Ollier's disease, and the other one is Ollier disease. If you have enchondromatosis with spindle cell hemangioma, you call this Maffucci syndrome, and these tumors are associated with IDH1 mutations, and the major differential diagnosis is Kaposi sarcoma. Of course, these tumors are negative for HHE8, but the morphology is enough to call this spindle cell hemangioma. Thank you very much, and have a nice